Welcome to this 6th World Symposium on Pulmonary Hypertension. It's my pleasure to officially open this World Symposium, and we will begin with introduction, welcome, and brief presentation by my colleague and friend, Professor Gérald Simonot.
Okay. Good morning, everybody. On behalf of the steering committee, on behalf of my French colleague, it's my pleasure to welcome you to this 6th World Symposium on pulmonary hypertension in Nice. As you know, since the first symposium in 1973, these different symposia have marked the progresses in the field of pulmonary hypertension, and also have anticipated the major advances in this field. I do believe it will be the case for this time too. In Nice in 2013, the picture of the Congress was a painting of Matisse called The Dance. In my mind, this picture can symbolize the strong and effective collaboration between the different actors acting in the fighting of this terrible disease. Today, the picture of the Congress is a painting of Chagall called The Angel's Bay. As many other artists like Bonnard, like Picasso, like Matisse, Chagall fell in love of Nice and the French Riviera and spent the last period of his life in Nice. This picture depicts very well the cobalt blue sky in winter of Nice and of Angel's Bay. However, I am not sure we could appreciate this year this sky because due to the very bad weather. The very sensual angels shown as a mermaid flying and smiling and offering some flowers provide us a very optimistic message that symbolizes the progress in the fighting and in the progress in this terrible disease. However, unfortunately, this picture can also symbolize a terrible event occurring on the 14th on 2016 in the Angel's Bay in Nice. This terrorist attack killed almost 100 people, innocent people, celebrating the French Day in the Angel's Bay of Nice. And I will ask you today to have a strong thought for their families in order to not forget these people. Thank you so much.
Thank you so much, Gérald, for that welcome. It's now my pleasure to introduce another member of the organizing committee, Professor Valerie McLaughlin.
Great, thank you, Lou. It's my pleasure today to welcome everyone here on behalf of all of the committees that were responsible for putting together this meeting. It starts with the organizing committee, and we first met over 2 years ago to get things started for this meeting. And for me, it's been an absolute privilege to work with Naz and Lou and Gérald in helping oversee this meeting. To make this meeting more broad and inclusive than prior meetings, we also put together a steering committee, a large steering committee for the first time, which is composed of 12 members from 4 different continents who have been critical in helping plan the subject and the content of this meeting. We've had lots of communications and have had face-to-face meetings at the American Thoracic Society to plan for Nice. There are also the task force members who have, for the past 2 days, been working tirelessly to put together the presentations that you will see today. There are, in fact, 123 task force members from 21 countries on 6 continents that have been involved in this meeting. 98 men and 25 women comprise these 13 task forces that you will hear from today and over the course of the next 2 days. Some of the topics for the task forces remain the same, but you will hear the updated data that has been generated over the past 5 years. Diagnosis and pathology and genetics are the same. Some task forces have been tweaked, some in fact separated to allow dedicated time to important topics. For example, left heart disease and lung disease have been separated and each now have their own task force. Others have been merged to be more practical for the end users, the physicians, the experts. For example, goals of therapy and therapy are now married into risk stratification and therapy, which will present a very cohesive approach to this topic. Some are entirely new. In fact, this year we have an entire task force dedicated to the patient perspective, which I think will be very interesting for all of us. We have not only experts who take care of patients, but our task forces are enriched by other perspectives, including those from the regulatory authorities, from industry, and this year, for the first time, from patients. So as our disease has evolved, as our treatment approach has evolved, as we have more and more data and approaches to therapy and knowledge of this disease, our task forces have evolved. This dynamic nature reflects everything that is going on in this disease state today, and we're very hopeful that the modifications to the task forces and to the agenda will be important and will increase the knowledge and education of pulmonary hypertension, and that you will all enjoy it. All of our task forces will have presentations, but one of the most important parts of this meeting is the interaction. So for all of the 123 task force members who've been working very hard for the past 2 days, we look forward to your input and your comments on our presentations. And so on behalf of all of the committees involved, I wish everyone a wonderful meeting and thank you for being here.
Thank you so much, Val. It's now my pleasure to introduce the 4th member of the organizing committee, Professor Nazareno Gallier.
Good morning. As Val already has explained, we started to work for this meeting on May 2015, and we organized the committee and also the steering committee, and identification was based on H-index on the field of pulmonary hypertension. In November 15, we had the vendor selection, and then on January 16, the sponsors meeting. And the first steering committee meeting was in May 2016, and the task force selection was made at that time at the ATS meeting of that year. Then the website for task force work started on January 2016, and since then the task forces have been operative, and the discussion, the final discussion, has been performed in the past 2 days. So we are here now, and this is the timeline we had yesterday and the day before for working around the presentation. So very fresh science. And as this is an example of Task Force 6 with, for risk stratification and medical therapy, and we worked a lot. Plenary sessions, what you expect in the next, this day and the next two. Today, 4 task forces, pathology and pathobiology, genetics and genomics, pathophysiology of the right ventricle and of the pulmonary circulation, and task force on hemodynamic definition and clinical classification and characteristics of PAH subgroup, and finally, diagnosis and of pulmonary hypertension. So tomorrow, 4 task forces: risk stratification and medical therapy of PH, right ventricular assistance and lung transplantation, trials design and new therapies for PH due to left heart disease. And finally, on Thursday, chronic lung disease, PH due to chronic lung disease, chronic thromboembolic pulmonary hypertension, pediatric PH, and patients' perspectives. Each individual plenary session is divided in 3 sections. The first 60 minutes are dedicated to slide presentations according to the different task force. There will be from 2 to 4 speakers. After the there will not be discussion after each talk. The discussion is at the end for all talks. The first 30 minutes, the first 10 minutes of the 30 allowed for discussion will be occupied by multiple choice question, and you can vote. I will explain how in a minute. And at the end, the last 20 minutes are dedicated to audience discussion. There will be 6 microphones on the stairs, and you can approach and ask directly your questions. For joining the voting system, you, with your PDA, can enter in the website of the Congress, and you find click here to vote. And when you click, you have this image, and the code to enter is S357. S357. Please prepare to have just a test. This is a question for today. How is the weather today? Sunny, rainy, or cloudy? Please vote. Of course, this is a test. You have then 1 hour to adjust for the test, for the questions of the first task force. This is just what the World Meeting have done in the past 45 years. Everything started in 1973 in Geneva with 17 experts. Then, after 25 years in Evian, the expert became 85. In Venice, 100 experts and 200 attendees. This was the first meeting in which attendees were allowed. Thanks. Okay. And Dana Point, attendees were 350 and 120 task force. This is Evian 5 years ago. In total, 1,200 attendees, and this is this year. So we are reached 1,500 attendees. This means a lot of interest around this field. And this interest is not only dedicated to science, it's dedicated to our patients. And as Val outlined, we have also a task force of patients. This is why it's a pleasure to me to invite Gabi Lowe from Cape Town, South Africa. She will speak on behalf of all patients and on behalf of the family of the patients.
Hi, It's both daunting and a great honor to be here. This is my daughter, Jenna Lowe. Looking back, there was a moment in time where our lives changed forever. It was the day that we first heard the words pulmonary arterial hypertension. Only we didn't know it at the time. It takes long, slow, agonizing time for that diagnosis to really land. Jenna was 17, incredibly beautiful, incredibly bright, with her whole life ahead of her. Her sister Christy, who's sitting here with us today, was 14 at the time. It's hard enough to face a diagnosis of idiopathic pulmonary hypertension. But when none of the treatment that you need is available, it becomes a battle, a war. We were absolutely horrified to discover that the only treatment available to Jen was sildenafil and, of course, anticoagulants. That was it. No center of care, no understanding of the disease, no one center where we could go, and certainly no access to drugs. Most of the medications, most of the treatments are not registered in South Africa. As a mother, this was unacceptable to me. As a family, this was unacceptable to us. We were going to do whatever we could to fight for Jenna's life, to increase her life, her longevity, and to increase her quality of life. And more importantly, Jenna took this on with such courage, grace, and equanimity. She wanted to make a difference in the lives of other patients. And so we started to campaign for awareness for the disease in South Africa. Jenna spoke on every radio station, every television station. She was in the printed media, in newspaper, and magazines. We took on the Medical Control Council of South Africa, filled in multitudes of forms to try and get permission to bring the drugs in. I had to stop work so that I could fundraise for the medication, because medical insurers don't need to cover you for the cost of medication that's not registered. And we tried to get doctors, and we did get doctors, to speak the language of collaboration. To sit as a mother with Google, which I'm sure horrifies you, but it was my only option. I'm at the tip of South Africa with virtually nothing on offer. And medical dictionaries, and try and work through what do we need, how are we going to do this, is absolutely terrifying. And so we took it upon ourselves to change the landscape of pulmonary arterial hypertension for South Africans. My husband resigned from a massive business and started a business from home because Stuart and I knew this was not going to be a long life. So do you want to be going to work at 7 in the morning, coming home at 9 at night, when you know you only have some years with your eldest daughter? And yet we fought. And we managed to get in some of the drugs that she needed, yet Jenna got worse. Part of the problem was that she was misdiagnosed for a long time with asthma. It took 18 months to get a proper diagnosis. And so we lost a lot of time in terms of treatment. Everywhere I looked, I heard about these 3 pathways to treatment, but not for us. And so we fought. We even went to Parliament and presented to Parliament, the family. We reached out globally, and I was astounded. This community sitting here is an incredible one. I'd like to thank Professor David Badesh UC Denver, Colorado, and Kia from St. Vincent's. They were willing to do anything to help me, to help Jen, to help us. We brought David out to South Africa. We held symposiums in Johannesburg and Cape Town, which we raised funds for so that we could spread the information, share the information with local doctors. We got local doctors to talk to international doctors. We did whatever we could, and we managed to get in some of the medication that Jen needed, and I cared for her. She was by then on a mobility scooter, on full-time oxygen, on Bazantan, on Revatio, on blood thinners. She still wrote her matric on oxygen, a big oxygen machine, 8 liters. She got 7 distinctions for her matric. She still tried to go to university, but she got worse, and she got worse. We needed Flolan, but there was not one patient in Africa on Flolan. What it meant for us was that we had to fight for it. The medication came from Dr. Frank Gray at GlaxoSmithKline in the UK. The cartridges came from Australia. The lines came from Australia. What we needed wasn't in South Africa. David Badesh flew out and taught us how to mix the medication, myself and Nurse Lizzie sitting there. And there was no one to help us. We built a little hospital room at home so that we could have a sterile place where we could mix the medication every day. But if something went wrong, there was no one to turn to. We took some of the medication and stashed it next door with our neighbor, just in case there was a fire, because we needed access to medication. There was no center of care to go to. By May of 2014, Jen was not doing well. She could no longer go to college. She was on 24-hour-a-day supplemental oxygen. She was on Flolan. And it became clear that she needed a transplant. You need to understand that from a patient's point of view, the first time you hear those words, lung transplant, it is brutal. But by now, it was our only hope. And it's funny how you can change. Something that you feared and dreaded becomes something that you hope for every second of the day. It was with huge amounts of horror that we then realized that actually, in the home of the heart transplant, the organ donation rate in South Africa is 0.2%. The chances of Jenna receiving an organ were very slim. And yet again, Jenna came to me, Christy came to me. What are we going to do? Mum, what are we going to do? And so Jenna launched a campaign. It was called Get Me to 21. She was at this stage 20 years old, in fact 19. She was 19 years old. And she would lie in bed and say to me, you know what, Mum, maybe I won't get my lungs, but in South Africa there's just under 5,000 people a day are awaiting a transplant. Jenna came up with this idea, and there was a local agency that helped us. She invited the entire nation to her 21st. It was a short video where she invited the entire nation. The only proviso was you had to be an organ donor. You had to sign up to become an organ donor in order to come to her party. What it did was it changed the consciousness of a nation. Overnight, that 40-second video went viral. It had 40 million views. It was astounding. People all over the world were watching Jenna's Get Me to 21 campaign. This young girl who couldn't leave her room increased the organ donation rate by 287%. When Jenna was 12, she wrote a poem, and that line was in the poem: I can make a difference, and a difference can make me. I find it astounding and yet very heartening. It is astounding that this is the 6th World Symposium, and it's the first task force on the patient's perspective. but it is so heartening. And thank you for inviting me, Professor Gabi, because I feel the patient's perspective is the one that is the reason we are all here. How do we get the same care to every single patient around the world? How do we give them a chance at a better quality of life, at a longer life? That is what we have to think of, hold in our hearts the whole way through the next 3 days. That is what you do. Our Jen received her lungs on the 10th of December 2015, and she had a very torrid time. She was in ICU for 6 months. We, the family, barely left her side, and she had many complications. We lost her on the 8th of June 2015. She was made South Africa's Youth Hero of the Year. One patient can change many, many lives, and we still do the work of Jenna's legacy. The family started a trust called the Jenna Lowe Trust, and we now have a clinic, and we are helping with advocacy for patients. But there is so much more to do. I thank you so much for listening, for hearing, and for doing what you do. When Jen was 18, she wrote a song. Christy, who's now 20, who's here with us, who I'm about to invite up on stage, and Jenna produced this song. It went to number 3 on the iTunes chart in South Africa in one day. And the title of the song is, I Need More Time. I think it's the heart of what we're doing here. So I'm going to ask Christy to come up on stage and sing the song for you. And behind her, there's a video, and you will see our Jen and some of the work that she did. Thank you for listening.
Thank you. Good morning, everyone. It's such an honor to be here today. I'm going to be singing I Need More Time for You. It's a very difficult song for me to sing, as you can imagine, but it means so much to me and my family. Jenna wrote the lyrics, and they kind of explain her story and how she felt throughout her journey. And I'm going to be singing it for her today and for every other PH patient that is struggling and going through what she went through. Thank you. Standing alone in a crowd, puppet smile on, voice too loud. Good isn't always enough, pain isn't fair, life plays rough, trying to shove this aside. Savor the moment, discover the sky. You only live once, they say. Imagine that you knew the day your time was up. And think about it, envy every single stranger, 'cause they have what you will never. Time enough. I need more time. I promise I could shine, 'cause I wouldn't waste what's rightfully mine. Recklessly spinning around, these empty fears run you to ground. Feeling your life speeding up, savor the moment, just know when to stop. to bear, hard to start, wanting to trust those I love. So much I can't give, just hope it's enough. You only live once, they say. Imagine that you knew the day your time was up. And think about it, envy every single stranger, 'cause they have what you will never time enough.
Hi, I'm Jenna. I'm 19, and I'm having my 21st birthday party now. And I'm inviting you.
I could shine. I need more time, 'cause I wouldn't waste what's rightfully mine. There is hope as long as there's fire in my heart, love in my soul. There is hope as long as there's fire in my heart, love in my soul. There is hope. I'm still breathing. I need more time. I promise I could shine. I need more time, 'cause I wouldn't waste what's rightfully mine. Thank you.
Thank you so much for sharing that with all of us. And it's now my great pleasure to begin the first plenary session and to invite the participants from Task Force 1, Pathology and Pathobiology, to come up to the podium.